Welcome to this educational video on warfarin. If you've been prescribed warfarin, you are not alone. Each year, millions of people successfully use this medication. Warfarin is prescribed for a range of conditions where there is concern that a clot may form in your bloodstream. You likely will have some questions, which we will attempt to address during the presentation. Warfarin is the common name for a type of anticoagulant. An anticoagulant is a medication that reduces the body's ability to form blood clots. You may also have heard of its brand name, Coumadin. It is often called a blood thinner, but really it does not affect the thickness of blood. It does decrease the amount of certain proteins in the blood that the body uses to form clots. It works best by stopping the formation of new clots, but also helps the body to naturally dissolve the clots that have already formed. Normally, we form small blood clots all the time. These are important to prevent excessive bleeding, like when you cut yourself or after surgery. Usually, your body dissolves these clots on its own. However, with some medical conditions, there is a risk that a large blood clot could form. This clot may block the flow of blood, or a piece of that clot could break off and travel to another area of your body, such as the heart, lungs, or brain. This can be quite dangerous. Fortunately, warfarin helps to reduce these risks. Four common situations that use warfarin are deep vein thrombosis, pulmonary embolism, artificial heart valves, following a heart attack, or for atrial fibrillation. Let's review. Venous thrombosis is a condition where a blood clot forms in a vein in various areas of the body, such as the arms, abdomen, or pelvis. The most common type of venous thrombosis occurs in the leg or thigh veins, also known as a deep vein thrombosis or DVT. Since the clot may limit blood flow, the leg may swell, feel painful, appear warm, or turn red, although not all leg clots will result in symptoms. Some causes for these clots can include recent injury, surgery, long flights, or with prolonged periods in bed. A further danger with DVT is that part of the clot could dislodge and travel to the lungs, causing a serious blockage known as a pulmonary embolism. This can leave you short of breath or cause a sharp chest pain when you breathe. Patients who have artificial heart valves may need to take warfarin to prevent clotting around or on the surface of the valve. Without warfarin for protection, a clot that did form could break free of the valve and travel to the brain, causing a stroke. A heart attack is often caused when one of the main arteries used to supply oxygen to the heart is blocked. In some patients, there is a risk of forming a clot in the bottom chamber of their heart since the heart's pumping ability has been weakened. These people may benefit from warfarin therapy. Warfarin may also be used for people who have certain irregular heartbeats, such as atrial fibrillation or AFIB. With AFIB, the top chamber of the heart, called the atrium, has an irregular movement that allows blood to pool and potentially form a clot. There is a risk that this clot may become dislodged from the atrium at some point, which could travel around the body, increasing your risk for stroke. All of these conditions can have serious consequences if left untreated, so taking an anticoagulant could possibly save your life. It is important that you understand the specific reason why you need to take warfarin, the duration of your therapy, and the desired blood test numbers. Be sure to discuss and confirm all this with your primary care provider. Your primary care provider could be your family doctor, nurse practitioner, a walk-in clinic physician, or other prescriber. When someone starts on warfarin, it is uncertain what dose will be needed, since everyone responds slightly differently to the drug. Some people need higher doses, and others may need lower doses to get the correct amount of blood thinning, or anticoagulation. In order to determine the daily dose of warfarin that you require, your care provider will arrange for you to have a blood clotting test called the International Normalized Ratio, also known as the INR. This simply involves going to a lab and giving a blood sample. You do not need to fast for this test. The INR is a measure of how long it takes your blood to form a clot. An INR blood test of 1.0 would be normal blood clotting in a person not taking warfarin. An INR of 2.0 means that it takes your blood about twice as long to clot as normal. We still want your blood to be able to clot, we just want it to take longer to do so. In most cases, your care provider will aim to keep your INR somewhere between a value of 2.0 and 3.0. Note that certain heart valve replacements will need different INR numbers, so be sure you know what type of new heart valve you have and that you confirm your own target INR range with your healthcare provider. Warfarin lab tests are very important because they help your care provider see how fast your blood is clotting. If your test result is higher than your target range, it means that your body has too much warfarin. In this case, your dose may need to be decreased. If your INR test result is less than your target range, then your warfarin dose may need to be increased. Warfarin has a slow onset of action, meaning it takes a few days to fully work when it's started or adjusted. Your care provider will want you to have an INR test on a regular basis to assess how the drug is working.
And then the amount that they've asked you to take.
You will need to have your INR monitored for as long as you are taking the drug. In the beginning, when you are just starting on warfarin, this may require testing multiple times a week. Later on, when you are stable on warfarin therapy, a blood test every 3 to 4 weeks may be sufficient.
Hi, this is Coco speaking from Northwest. I am calling to let you know about your INR result.
Following an INR test, your care provider may phone and ask you to change your warfarin dose, as well as tell you when you need your next INR test.
Bye-bye.
Please ensure that you have an answering machine or voice mailbox so that your care provider can leave important messages regarding your warfarin if you cannot answer the phone. Call your care provider's office if you haven't been contacted within 2 days of a test. Portable monitoring devices exist that allow patients to self-test their INR using a small finger prick blood sample applied to a test strip and meter. These devices may provide convenience and flexibility to some patients' lifestyles, but they are not appropriate for all patients. If interested, ask your healthcare provider or pharmacist for more information on the devices currently approved by Health Canada. There are many strengths of warfarin tablets. The number of milligrams is imprinted on each tablet, and each strength of tablet comes in a different color. Remember to check both the strength and color of your tablet prior to taking each dose or when picking up new prescriptions from the pharmacy. Note that your care provider may prescribe more than one tablet strength to make your total warfarin dose. Because your community pharmacists may not know your intended dose, your prescription labels may only read, "Take as directed." Also, your prescriber may ask you to take a different warfarin dose on different days. For all of these reasons, it can be very easy to get mixed up and lose track of your current warfarin dose. Therefore, good record keeping is very important to ensure that you continue to take the warfarin dose intended by your care provider and help prevent doses being missed. You might find it helpful to use a calendar, daily planner, or one of the many smartphone apps available to record the INR results and the warfarin dose taken each day. If you miss a dose, then take it as soon as you remember. However, if it is getting close to your next normal dose time, just skip the missed dose and continue with your usual schedule. You should never double up the dose to catch up. Be sure to let your healthcare provider know about the missed dose at your next INR follow-up, as this may explain a lower than expected test result.
Can you tell me if Dr. Jones is in?
If you miss taking your warfarin for 3 or more days, then call your healthcare provider directly for advice. A weekly dosette or pill box may prevent missed doses and keep you organized. We recommend that warfarin be taken at a consistent time, preferably supper or bedtime. This is because when you have your INR test done in the morning, your care provider can assess your test result and call you prior to your evening warfarin dose. This way, you can promptly respond to any dose changes when your care provider phones you. Do not stop taking your warfarin unless told to do so by your healthcare provider. It may have serious consequences, such as a stroke. Thinking about your diet is important. Green leafy vegetables such as broccoli, spinach, or kale may be especially high in a substance called vitamin K. This vitamin K can interfere with warfarin, making it less effective. If you routinely eat a lot of these foods, your care provider may need to increase your warfarin dose to compensate for this extra vitamin K. This does not mean that you cannot eat green leafy vegetables, but rather you should aim to have about the same amount of vitamin K foods in your diet per week. You definitely should not binge on any of these foods. Also, make sure your care provider knows if you are planning any significant changes to your diet. Which foods have a lot of vitamin K? Your healthcare provider, pharmacist, or dietitian should be able to supply you with a list. Consuming alcohol, whether in beer, wine, or hard liquor, may increase your INR test result, and excessive use can increase your risk for bleeding. However, it is not necessary to abstain from moderate alcohol consumption, such as a glass of wine with dinner. Finally, you should inform your healthcare provider if there's any significant change in your lifestyle, such as weight gain or a notable change in exercise pattern. You can still enjoy many of the same activities you engaged in before you started taking warfarin. You just need to be a little more cautious. High-risk contact sports and potentially dangerous activities should be avoided. If you are planning on becoming pregnant, then contact your healthcare provider urgently to discuss your anticoagulation.
Do you have it with you?
I do.
Many prescription and non-prescription drugs can either increase or decrease the effect of warfarin. If you are prescribed a new medication, or have a dose change, or stop one of your regular medications, then ask your healthcare provider if the change might interfere with your warfarin. You may have to go for more frequent INR tests, and your warfarin dose may need to be adjusted. It's important for your healthcare provider and pharmacist to have an up-to-date list of all of your medications, including herbal products and supplements, as some of these could also interact with your warfarin. It's a good idea to get all of your prescriptions filled at the same pharmacy so your pharmacist can be aware of all medications that you are using. Anti-inflammatory drugs, such as ibuprofen, naproxen, or aspirin, are common pain medications, but they can increase the risk of bleeding in the stomach when you are using warfarin. Since these anti-inflammatory medications can be in many over-the-counter products, always seek the pharmacist's help in selecting non-prescription medications. Note, however, that low-dose 81 mg ASA or aspirin may be prescribed in combination with warfarin for certain situations, such as mechanical heart valves. Be sure not to take an anti-inflammatory drug unless it has been specifically prescribed for you by your healthcare provider. Consider acetaminophen or Tylenol instead for minor pain, headaches, or fevers. Warfarin is a safe and effective medication, but as with other medications, it must be taken as prescribed. If you take too little warfarin, it won't work properly for you. If you take too much, you might experience side effects, which may show up as bruising, bleeding gums when brushing your teeth, or nosebleeds. It is important to realize that minor bleeding and bruising may occur even when your INR is within your target range. You may also find that if you cut or nick yourself, you may bleed more than usual. This type of bleeding does not usually require treatment. However, let your care provider know about this bleeding at your next visit. More serious side effects, which are less common, are blood in the urine or stool, or unusual or unexpected vaginal bleeding. Major bleeding should be assessed by a care provider right away. This includes if you vomit up blood or something that looks like coffee grounds, pass pink to dark brown urine, have black tarry stools, or experience bleeding from cuts or nose that do not stop. You may be more prone to bleed from a bad fall while you are on warfarin therapy. If you have a serious fall or injury to your head while taking warfarin, then contact your care provider for advice. You should always inform all doctors, your dentist, and other healthcare providers that you are taking warfarin, as it can affect the way you're treated. Many people who take warfarin, such as those with mechanical heart valves, may require antibiotics before certain medical procedures. If you require surgery, sometimes your warfarin therapy may have to be stopped in advance and another drug used in its place. It's a good idea to get a medical alert bracelet that states that you are a warfarin patient. In an emergency, a medical alert bracelet will tell ambulance and hospital staff that you are a warfarin patient. Bracelet application forms may be found at most pharmacies. One of the most often asked questions is, how long will I need to be on warfarin? This largely depends on the underlying condition. If you have suffered from clots in the legs, then a few months of therapy may be all that's needed. However, if you have a mechanical heart valve or an irregular heartbeat, then you may likely need lifelong warfarin. We've covered a lot of important information in this video, but you can go back and review any topic heading as needed. If you still have questions about your warfarin therapy or your underlying medical condition, then write them down and your pharmacist or primary care provider will be better able to address your concerns. Warfarin is prescribed to reduce the blood's ability to clot. Inform all your healthcare providers that you use warfarin and consider a medical alert bracelet to alert emergency staff. It is important to take your warfarin pills exactly as directed. Remember to check both the strength and the color of your tablets. Get your INR checked as scheduled. Keep your diet consistent. Avoid excessive alcohol or binge drinking. Consult your healthcare provider before making significant lifestyle changes. Notify your healthcare provider if you experience difficulty breathing or chest pain, coughing up or vomiting blood, a serious fall or blow to the head, illness, fever, or infection that does not improve. If you forget to take a dose, Do not take an extra pill with your next dose to catch up unless your healthcare provider instructs you to. Check with your pharmacist first before starting any new over-the-counter medication, supplement, vitamin, or natural health product. Do not use anti-inflammatory medications, including aspirin, unless it is specifically prescribed. Consider acetaminophen or Tylenol for headaches and fevers. If you are pregnant or plan on becoming pregnant, then contact your care provider immediately to discuss your anticoagulation plan.